If you're really interested in the science of disease and the diagnostic aspects, you don't really get that in a lot of forms of clinical medicine because, you as a patient may have the most interesting disease in the world, but what you care about is feeling better. And so when you go to your doctor, to your internal medicine doctor, or your family care doctor, what you guys are going to talk about is make me feel better or cure my disease. You're not going to talk about the fact that Waldenstrom's macroglobulinemia is a fascinating disease, and here's the pathophysiology, and here's what it looks like under the microscope, and here's how we diagnose it. So I'm so grateful that most people are clinical doctors because they take care of all of us, but if what really makes you want to get up in the morning is understanding and diagnosing the disease, you don't get that out of a lot of other branches of medicine. My name is Laura Lamps. I'm a professor of gastrointestinal pathology in the pathology department, and I'm also the patient safety officer for the University of Michigan Health System. I've been doing this for more than 20 years, and I can honestly say I've never been bored, ever. And when I hear people say, oh, I'm burned out, I'm tired of looking at slides, I find that impossible to even understand because you see so much interesting stuff every single day. And I think to have a job where you're never bored and you have that variety and that ability to continue to learn, I think that's really a gift, and that's an amazing thing. I don't think people realize, certainly not your average layperson, what a huge role pathologists play in the diagnosis of their disease and the determination of their therapy. And I think that's something that it's really important to come to recognize, which is, let's say someone has colon cancer. So the pathologist is going to make that diagnosis. They're going to say how advanced the disease is. They're going to do some additional testing that will help determine what kind of chemo the patient gets, what their prognosis is to a further degree, and then even if they have a situation that's genetic that will affect their kids. And that's a lot of important information that I think most people don't realize comes from the pathologist and just looking at the slides. One thing it is nice to show people is that pathologists do have very visible positions throughout hospitals. They might be the safety officer, they might be really interested in patient and family-centered care because, Jeff and Lauren Smith are really interested in helping patients understand their own pathology reports. They might be very visible educators, with medical students. So there's a lot of avenues that pathologists can take. I really like my GI group, of our group within the GI section, because it's such a wide range of ages and levels. So, our youngest person is 2 years out of training, and our oldest colleague is Henry, who's 83. And so that's just such an amazing range of people and expertise. And so one thing that keeps me going is interacting with those people. Henry, if I have a question, I have older, more experienced colleagues to go to, but then if any of my younger colleagues have a question, they have tons of people. So that keeps me going, that interaction and that level of expertise.